At the moment, I think homeostatic, allostatic processes could be influenced by biomechanical, neurological, metabolic, energetic, circulatory, respiratory, and psychosocial overload. At the moment, I could say that psychosocial overload could be the most present, maybe often or always present in the persons that visit my office. Of course, osteopathic palpation findings. When I say osteopathic palpation findings, I refer to tissue alterations, fascial tissue alterations, localized or generalized in the body. Localized, such as somatic dysfunction, and generalized in the body, I'm speaking about fascial patterns described in our tradition. So, osteopathic palpation finding behind biomedical finding, and I'm speaking about biomedical finding of allostatic load, stress, and self-regulative functionality. I mean biomechanical, neurological, and so on. Also salutogenesis indicators. And so first osteopathic palpation finding, second biomedical finding, and third, I think, the clinical relevance hypothesis. So 3-step. First of all, I think osteopathy is changing. Second, I'm a full-time osteopath, so I did a full-time course. And the 3 tips, I think curiosity, passion, and critical thinking.
What do you mean with critical thinking?
Well, the science of doubt. So I say something to you, you just say why, and then process, and then process with your art. So we can have a common idea, not just my idea. So critical thinking could be like a mixer where we can put inside our ingredients, our osteopathic ideas, our solo player, and we can put on and we can process and have our renovated osteopathic approach that is a little bit more shareable and shared, I hope. Well, I think thinking a little bit on the distinctive role of the osteopath in the process of care could be a good chance. Because if you focus on the distinctive role, you could be inside a team, for instance, in your town, where you do your work, your osteopathic care, behind medical doctor, body worker, physiotherapist, and so on. Because sometimes in the past was not really clear the distinctive role of the osteopath.
So getting a good network.
Yeah, for instance, in my practice, I do, of course, osteopathic technique with patient on the table, on the osteopathic table. But also, I practice with patients osteopathic exercise. But what is osteopathic exercise? Exercise is exercise. On Pilates class and on yoga class and with the osteopath. But osteopaths do exercise related to the diagnosis, to the osteopathic diagnosis. And when I do this, in my point of view, in the real world where I live, it's coping strategies that bring that person to the body worker, to the physiotherapist. So I could do some interprofessional approaches, but in the osteopathic point of view, to open the mind, to stretch the mind of the patient, and to bring him, to suggest him, to advise him, and to bring him to other professionals. Probably sometimes they are in charge and you are behind. Sometimes you are in charge. But most of the times others are in charge with the disease and you are in charge. If the person likes to be touched, you are in charge to manage the overload manifested in tissue, I think. Which is the role of the osteopathic care?
Okay, yeah, this is a good one. And what would be your answer to that?
My answer is that in general, about the health needs, we need adaptive healthcare process, not technical. And I think definitely that osteopathy is an adaptive healthcare practice. So in our diagnosis and in our treatment, we have to manage the adaptive process and self-regulative process as our principle, our André Steel principle, say to us that for reality they are not osteopathic principle, the third principle are biological principles that Andrew Taylor Still say to us, not the principle, but a way to practice those principles with people.
Yeah. Okay, was it better for me? Thank you so much.
Thank you very much. And enjoy the Kongress.